Okay, so we're good. Smooth 98.1, love music, love life. It's time for soul food. If you check it, it's 2 or 3 minutes now past 8 o'clock. You're very welcome to the show that educates you on your health and wellness every Saturday morning here on the smoothest dial on international radio. This is Soul Food. My name is Oluwaseun, and you can be a part of it. We are discussing oral health this morning. So the channels for you to be a part of it, we have the WhatsApp line, we have the call line, and we also have the YouTube. Of course, there is also Twitter that allows you to drop your comments at any point of the show. Just make sure you tag us on Twitter at Smooth981FM and you use the hashtag SoulFood981. You can go to YouTube right now where we're streaming live for record purposes and also to allow you who is not in Nigeria listen and watch. The channel is youtube.com/smooth981FM Lagos. Remember to subscribe and of course, click on the notification bell so that going forward, you'll get the alerts. Well, maybe not the kind of alerts that comes to your mind once you hear that word, but the one that allows you watch educative content. That said, I have a dentist this morning because it's only right that we have a dentist to discuss the topic of oral health and aging. And his name is Dr. Abdulalim Nuraen from Smile Doctors, Nigeria. Good morning.
Good morning.
Thank you for your time this morning. I appreciate you.
Thank you for having me on your show. It's nice to be here with you.
Thank you. Let's get to the basics just to create a context for somebody who's listening. If we are defining oral health, what does it entail?
Okay, so when we are talking about oral health, it means anything that has to do with the oral cavity, the health status of the oral cavity, our mouth. That is our mouth, our teeth, our gum, the cheek, the inner part of the cheek, and a part of the front part, we call it the anterior part of the throat. That's like the posterior part of the tongue. So when we talk about oral health, it incorporates all these integral parts of the mouth. That's oral health.
So what's the difference between dental health? Because a number of us use it interchangeably. Are they the same, oral health and dental health?
Some terms can be used generally, not restricting dentistry now. Some terms are known to be used interchangeably, especially when they are used separately. So oral health, dental health can be used interchangeably, especially when they are used separately. But when we combine it, when we are using it in the same, let's say in the same sentence or maybe in the same phrase, we can actually differentiate them. Dental health will specifically mean the health status of our teeth. So when we want to differentiate, while oral health is kind of more encompassing, which means it entails everything in the mouth, every single structure in the mouth. So that's like the difference between dental health and oral health when we are differentiating.
Thank you for that very important differentiation. Now somebody is more aware. I am more aware of it now. So let's go to what we plan on discussing today, and it is how aging affects oral health. So this, we will talk about oral health now, not just dental health, since it goes beyond the teeth. So the aging process is very normal. But then how does it tell on a person's oral health?
Okay, so as you have said, aging is a natural process, and it comes with a lot of physiological changes, a lot of normal physiological changes. So aging, there are some peculiarities of the aging patient, the elderly patient. First, they usually have comorbidities. That is, some systemic illnesses, some chronic illnesses. They are peculiar. They are known for comorbidities. Example, diabetes mellitus, hypertension, cardiovascular diseases. So these chronic conditions, they have effects. They affect the oral health. For example, diabetes mellitus. It has been shown that diabetes mellitus and periodontal diseases have a bidirectional relationship. What does that mean? It means if a patient, an elderly patient, has diabetes and it's not well controlled, that will impact negatively on the periodontal health. When I say periodontal health, I mean the gum and the supporting tissues around the teeth. So if a patient has diabetes that is not controlled, it will affect the periodontal health of that patient negatively.
Are you still there? Okay, you're muted now. All right, we have you back. Yes, I can.
So as I was saying, so diabetes is a good example. It affects the oral health by negatively impacting the periodontal health of the teeth. Another peculiarity of the aging population is that because they have comorbidities, they tend to take a lot of prescription medications, over-the-counter medications. So these medications, they have adverse drug effects. They interact, which most times manifest in the mouth. It affects the oral health. Some of the adverse effects of those medications, they manifest in the mouth. A very good example is what we call xerostomia. Xerostomia is dry mouth. It's a very common condition in the aging population, and it's usually caused by adverse reactions of the drugs, the medications that are being taken for the chronic illnesses in those aging patients. Another peculiarity.
Okay, before you go to the another one, let's take a quick break. When we come back, we'll continue from where you stopped.
Right,
thank you. All right, so if you're joining us for the first time, we are discussing the topic of aging and oral health. My guest is Dr. Abdulalim Nuraen, and you can join us on YouTube. It is youtube.com/smooth981FM Lagos. Stay with us and we'll be right back.
Hey, what's up? Oh, yeah. This is Dare. Stay tuned, stay locked.
So just a minute's break and we're back.
A day to remember in the history of our dear country, Nigeria. 9 wise men from the north who were governors came together on June 8th, 2022 to stand for equity and fairness. We salute our brothers and sisters in the northern part of this country who, in spite of their enormous votes, continue to propagate the unity of Nigeria by promoting rotation of presidency. Let's vote Bola Tinubu for president, for a renewed hope, a better Nigeria. Vote Kashim Shettima as vice president. Vote APC.
When you think about working for money, what comes to your head?
Your earnings, your spending, your savings. Tune in to Smooth 98.1 for a definitive weekly analysis and check on your income.
You want cash flow that pays very little taxes.
Stay on top of money matters with the experts and make mastery of financial management on the global scale.
What a way to run your life.
Personal Finance on Smooth 98.1 every Wednesday from 5:15 p.m. It's all about your finances made easy. We are your number one.
Okay, we're back.
Contemporary radio.
And we're right here with you, teaching you about aging and your oral health. I know it's breakfast in bed, but I really hope you have brushed this morning. Please go and brush your teeth if you have not. And if you belong to the class of people who have not changed their toothbrush in 2 years, Please change it. Change it. Your toothbrush should not look like a mop stick or something that has been through the street of Lagos Island. Thank you very much. That said, my guest this morning is Dr. Abdulalim Nuraen. He's on Zoom, joining me via Zoom. And of course, we're streaming live to YouTube. It is youtube.com/smooth981 FM Lagos. So before the break, you were telling us about how some of those conditions that come with the aging process, like diabetes, like hypertension, the comorbidities that then make oral health to be compromised. So what are the other ones?
Yes. So as I was saying, another peculiar condition in aging patients is cognitive impairments. Example is dementia. So this condition, this cognitive impairment, it makes it difficult for this set of people to follow instructions. It makes it difficult for them to perform certain tasks, and they tend to forget things easily. So that affects the oral health in that they are not able to carry out good quality home oral care. So this will now lead to accumulation of plaque and calculus, what people call tartar. That's the deposits around the teeth, because they are not able to take good care of their oral health. And this eventually will lead to oral diseases and some oral health conditions. Another peculiarity, another disease that's common in aging patients is physical or sensory impairments, such as hearing impairment, visual impairment, maybe an inability to walk, inability to move the hands. So this also affects the oral health, because patients that cannot move, it's difficult for them to visit the dentist as it's recommended that each person should visit a dentist twice a year. It's also difficult for them to carry out simple tasks to maintain good oral hygiene. So these are some of the peculiarities of aging process that affect the oral health of and the elderly patients.
Thank you for the enlightenment. So what about the other side, say the normal, maybe wear and tear that comes with using the teeth over the years, or maybe the kind of diet a person has taken through their lifetime? Can those things tell on a person's oral health when they're older?
Yes. They're also peculiar. They're also known with aging patients. They are more of physiological process in the aging patient, because it's, as I said, it's a normal process that as you grow old, the tissues, these organs in the body, they grow old with you. So there is this normal wear and tear that comes with use, and that also affects oral health. That affects the teeth. There's what we call attrition, that's wearing off of the surface, like a frictional force over the years, which wears off the surface of the teeth, and it makes the surface flat. And at times it can even deteriorate to involve the pulp, which is the life of the tooth, and manifest and give symptoms such as pain and discomfort. So wear and tear as a form of aging also affects the oral health, and it also affects the teeth and other structures in the mouth.
Thank you. I do have 2 questions from what you have explained, but I'll be back to that later on. Now, I remember, so the diet, one of the reasons I asked a question of the diet is because when we were growing up, I don't know if you ever were told that, but they'll tell you, oh, stop chewing gum, because when you grow older, your teeth will fall off. and some other foods that you'll be told not to eat, or maybe snacks not to eat. So what are some of those things that we are eating now, or the children are eating now, that if they do not check it, it could affect the oral health in the long run?
Okay, let me start from chewing gum. Chewing gum, it's actually recommended, but the type of gum is
My
what
primary
should
school
be.
teacher needs to hear this.
So it's just the type of gum that should be checked. What we recommend is a sugarless gum. That is what we recommend, because
But
there
why
are
is
so
it
many.
recommended?
Because it helps with development of the jaw, and also it's a form of exercise for the mouth and the joint, the jaw joint, the temporomandibular joint. So we recommend chewing gums that do not contain sugar. So that helps the jaw to grow, and also it helps to kind of massage and exercise the supporting tissues of the teeth. So so for the foods that should be avoided, that may later cause some issues later in life as we grow old, is those substances that are add food substances that may wear out our teeth early than the normal pathway. So add food substances is what we usually advise and preach against. We tend to discourage people from biting on ice, edible ice. We tend to discourage people from chewing bone. A lot of people have the habit of chewing bones. So we tend to advise people against that it has a negative effect on the teeth. And
Please hold on. Sorry to interrupt you. I just want to clarify on behalf of the bone chewing community. Is it that we shouldn't chew bone at all, or we should be mindful of the kind of bones we chew?
Okay, that's good. So to clarify, we should be mindful of the kind of bone we chew. Bones that will make us to stress our jaws and all should be avoided. But maybe the common ones, what people call biscuit bone, brisket, the bone in the brisket meat, that those ones are soft form of bones, so they are not hard. But not crunching, maybe goat meat and all. So, so those ones are not advisable. So in essence, what we eat affects how our teeth age, how our teeth react as we grow old.
Thank you. So let's talk about the symptoms. What are those things a person starts to see and they feel now, or you should begin to get aware that this could be age-related symptom or oral health as a result of aging? I don't know if that you understand what I just said, but and aside that, at what age can a person, or will a person start seeing the symptoms? So first, what are those symptoms that you see in a person and you look at them and say, this is age-related, and at what age?
Okay. So there are some conditions that are commoner in aging population, in aging patients. A good example is periodontal diseases. Periodontal diseases such as acute gingivitis, chronic gingivitis, chronic periodontitis, percussion involvement. That is conditions that has to do with our gums. Maybe gum bleeding, swelling, which goes on to cause mobility, to make the teeth to start shaking, or even teeth loss. Yes, these are kind of commoner in the aging patients. But it's like a myth in our environment that as you grow old, your teeth are supposed to just fall out naturally, which is not supposed to be. if we take good care of our teeth. But because people in this part of the world, we don't usually attach so much importance to our oral health. So we feel it's normal for us to lose our teeth as we grow old, which is not normal. But in this environment, the commonest conditions we see in adults and in aging patients is mobility, that's shaking, teeth shaking, and teeth loss. Usually they are commoner in aging patients. And when we talk about aging patients or the elderly patients, we talk about the age range between, let me say, from 65 years old and above. That's the standard age for classifying someone as an elderly patient, and that is when all these manifestations, that's when they are more pronounced in an individual.
Thank you so much. So back to the question on wearing and tearing. Over the years, we would eat, we will chew on things, and we might not be able to, it's normal that we have to eat and we have to use our teeth to eat. So the question is it possible to slow down that wearing and tearing, or do we have to do something to prevent the wearing and tearing as a result of use over time?
Okay, it depends on our habits. It's as we both agreed and we've established that it's a known fact. Aging process is a natural process, so it will eventually occur. But we can kind of mitigate, kind of manage the process such that we do not fall at the extreme end. What I mean by that is we watch what we eat. We take good note of what we eat. And that is by making sure that we do not overstress our teeth by biting on hard food substances. Because as I've said, hard food substances, they wear off the teeth surfaces faster than moderately hard and soft food substances. So if we want to kind of maintain and manage our teeth better, we should actually reduce as much as possible, stop biting on hard food substances and do more of moderately hard and soft food substances. So in that way, we can actually limit the process of wear and tear that comes with aging.
Thank you. I feel like there are some people I personally know that I should send this video to. I'll definitely do it at the end of the show. But if you're listening and the message just relayed affects you personally or somebody you know that is fond of biting, ice is one of the prime suspects here. If they are in this WhatsApp group, please send a video to them and also take heed since you have learned of it now. Be careful of what you chew on. We'll take our final break, and when we come back, we'll be taking your calls and messages. So if you have listened so far or you have any questions for the dentist, you can quickly, because we have very limited time, so you can quickly send your WhatsApp messages to 0809 444 0981. Again, 0809 444 0981. And when we come back, you can also call 01448 9981. Just for context, we have about 4 minutes. So if you want to do that, you have to do it as fast as possible. This is Soul Food here on Smooth 98.1. So we just have 4 minutes to the end and we wrap up. So when we come back, we'll be taking general preventive methods and tips from you on how to just maintain general oral health over the years. That when you're 60 or 65, your teeth do not necessarily need to fall out. So just that and recommendations.
Biggest bonus ever. 1xBet is a reliable bookmarker. So head up to 1xBet.ng. Register with promo code Welcome Nigeria and get a huge welcome bonus on your first deposit right now. Have a chance to win. 1xBet gives you more. Love music. Yes, yes, y'all. You are listening to the voice of the one and only Mr. Incredible, short black boy, African rapper #1. And this is the sound of Smooth 98.1.
Exactly. And we want you to continually enjoy the sound of music in good health. Trust me, the pain of heartbreak does not even compare to when you have toothache. I'm sure Dr. Nuraen can bear me witness. That kind of pain, it enters your soul. If you think breakfast means have breakfast by another human, heartbreak, it's painful. Wait until you have oral disturbances and you know that there is pain and there is pain. That's why we are taking your calls and messages right now. You can call 014489981. Hello, good morning.
Hello, good morning.
Good morning, sir. What's your name and location?
Yes, Mr. Chok is my name. I'm actually calling from traffic.
All right, thank you for calling. Questions?
Yes, I really enjoy their program. I want to ask, as a dentist, most times when you want to go and buy a toothbrush, they will ask you if you want hard, soft, and hard. What is the effect of those varieties on both age and the health status of the teeth?
All right, thank you. You can keep listening. He will answer the question. All right. Okay. So over to you.
Okay. So what we recommend is a medium bristled toothbrush. That is what we recommend for the average individual. So the effect of brushing with hard bristled toothbrush is that it wears off the surfaces of the teeth, and it causes what we call cervical abrasion. So that is wearing off of the surface of the teeth at the junction between the tooth and the gum. It also causes gingival recession. That is the gums receding, going down and exposing the root of the tooth. So brushing with hard bristled brush is not advisable, even for smokers. There is this misconception that when you smoke, you have to brush with. So for smokers also, it's still medium bristled brush. For smokers, what they should do is go for regular dental checks and cleaning, professional cleaning. So for for aging population, it's either a medium bristled toothbrush or a soft bristled toothbrush. So now that will now be determined by the dentist or the caregiver that is managing that such patient, or that is seeing that or caring for such patients. But generally speaking, medium bristled brush is what we recommend. But in some instances, some cases, we do recommend soft bristled brush for some people, some patients. But generally, medium bristled toothbrush is the recommended toothbrush.
All right, thank you. I hope that answers your questions well. 014489981 is the number to dial. Hello, good morning.
Hello, good morning.
Good morning. Please turn down the volume of your radio set.
Okay. Yes, I am Mr. Wanguma.
All right, calling from where?
Calling from Lagos, Lagos.
Thank you. Your
Yes,
question
I
quickly.
want to ask, what is really the cause of this toothache that always results to removal of teeth? Most people are suffering that. What is the cause? And what is the remedy to that? Thank you.
Thank you for your question. Keep listening. All
Okay,
right,
so
quickly.
Quickly. Toothache usually is caused by a number of causes, but the commonest ones that are caries, dental caries, and periodontal diseases. Dental caries, periodontal diseases, they are causative agents, and the processes are quite similar. The factors that come to play that what we take, our diet, when we take high refined sugars, high intake of refined sugars can predispose us to all these dental issues. Poor oral hygiene also predisposes us to this. Time factor plays a key role, and that's why we advise regular checks. Also, our habits too, smoking, alcohol intake also predispose us to teeth problems, toothache and all. So, and how we can prevent it is to go for regular checks and ensure that we maintain a very good oral hygiene. And there is this misconception that once you have toothache and you remove a tooth, it moves to the next one, and you keep removing teeth. So this is also, anytime I have the opportunity, I try to clear that it's a big misconception. What usually happens is people don't take care of the cause of that first pain and first removal, and they keep the habit. So that process continues. But once you stop that habit, you inculcate the habit of a regular checkup and all, it doesn't affect or it doesn't move to the next tooth. Thank you.
Thank you so much for the information this morning. I hope at least one or two persons have been liberated, because knowledge is power and it is liberation. So thank you, and thank you. For those who are just joining us, you might have missed out, but there is a replay for you on YouTube. Just go to our YouTube channel, which is youtube.com/smooth981FM Lagos. You'll find this video right there. You can watch and also send to your parents, your family, brothers, sisters, and loved ones. If you want them to be old and still eat well, and of course, you don't want them to be having that debilitating pain that comes with toothache. Thank you. My guest has been Dr. Abdulalim Nuraen Abiodun. Thank you so much for your time this morning. And of course, it's from, thank you. It's from smiles.com Dental Clinic in Lekki. He's not active on social media. I would have said you should look out for him on social media. So yeah, we'll just keep it at that then. Thank you. All right, enjoy the rest of your morning, and yeah, good luck with you and your patients.
All right, thank you very much. Enjoy the rest of your day.
Thank you so much. Bye. All right, and we're done for now on Soul Food, but you know that 8:40 till 8:55 is for the children between 6 to 15 years of age. They come on the show called Curious Minds. They get to spell and win themselves a chance to be in the studio on the last Saturday of the month, and that comes with some interesting packages. So if I were you as a parent or as an uncle and auntie, I'll tell them to come around so that they have a great time in about 5 minutes time. You're listening to Smooth 98.1.
And the rest will follow.
Thank you so much. So later on, I'll send this video to you in case you want to just share or maybe
and work really hard
have
on being good at you.
Healthy mind, healthy body, healthy